So one of the things that we're concerned about is the prevention of Alzheimer's disease. At this point, we can't say that we can prevent Alzheimer's disease, but the medical community can make some very specific recommendations to people that are concerned about the possibility of getting Alzheimer's disease. And they're basically just good health practices, common sense recommendations. And I think that what I'm going to say in this regard would not be disputed by anybody in the medical community with some knowledge of this area. The first thing that we recommend is that people make sure they see their doctor on a fairly regular basis and keep their blood pressure under good control. In fact, my specific recommendation is to keep the blood pressure systolic below 130. There seems to be a relationship between blood pressure and the risk of developing Alzheimer's disease. The lower your blood pressure, the less your risk. So that's one thing to consider right off. The second thing that I recommend, that something you see on television all the time anyway, is watch your cholesterol and make sure that your cholesterol is under good control. In fact, not only is cholesterol associated with heart disease, and people who keep their cholesterol down have less risk of heart disease, but it seems to be that some of the cholesterol lowering medications may significantly reduce the risk of getting Alzheimer's disease also. So this is an important thing to consider. The third thing that I recommend that people do is get plenty of exercise, both of their body and their mind. People who exercise regularly clearly are healthier, and this is one of President Bush's big pushes at this time, is to get people to exercise more. There is some evidence that people who exercise more have healthier brains and may have a reduced risk of Alzheimer's disease as well. There's clearly evidence that people who've had more education have less Alzheimer's disease. While the reason for this is not clear at this time, I think that it's good common sense recommendation that people get as much education as they can. The fourth thing that we recommend that people do is that if they have diabetes, that they need to follow the diabetes control very closely with their doctor and keep under the best possible control that they can. If you have arthritis, the fifth thing, see your doctor and make sure your arthritis is well controlled. Some of the arthritis medications seem to substantially reduce the risk of Alzheimer's disease as well. While this has not been proven yet with a controlled study, there is enough indication that this is the case in several epidemiological studies that we definitely think that people who have a medical reason to take these medications should be taking them. The next thing is that we are recommending vitamins to people. I myself take 400 international units of vitamin E per day, 250 milligrams of vitamin C, as well as a multivitamin tablet and a baby aspirin per day that is enteric coated. Those are the things that I'm doing for myself just because of my own concern about the potential risk for Alzheimer's disease, unrelated to any particular family risk. A large number of the doctors are doing this already. There are other things that we need to look at as well. If you're a lady who's past menopause, you need to be talking with your doctor about female hormone replacement therapy. There has been some recent evidence that female hormone replacement therapy can also reduce the risk of Alzheimer's disease. Another factor that we think is important is the question of sleep. And there's a medication called melatonin. Actually, you get this at your health food store or at your drugstore or grocery store. But there has been some evidence that melatonin can help you sleep. Perhaps if you're getting elderly and having difficulty maintaining your sleep cycle, it may be because you have a deficiency of melatonin. If that's the case, that can help you sleep. But there's also some evidence that melatonin might help to reduce the risk of Alzheimer's as well. The last thing that I recommend is that if you do have a memory problem, talk to your doctor about it. The concern that we have is that the medications available for treating Alzheimer's disease at this time that are FDA approved may not only make patients function better, but may slow down the rate of progression of the disease. The longer you wait, the less benefit these medications will give you. So as soon as you have a concern about your memory problem, you need to go and have a discussion with your doctor about possibly taking these medications. Another concern we have had is that people who have had head injuries seem to have a substantial increased risk of Alzheimer's disease. Auto accidents, falling and hitting their heads. there seems to be a 5-fold increase in the risk of getting Alzheimer's disease. Certainly one of the things that we're recommending is that if you are wearing a seatbelt in your car, that's a healthy thing to do. And if you're riding your bicycle or involved in some strenuous activity where there's a risk of falling, you should be wearing a helmet. That brings to 10 the number of factors that we're recommending at this time as ways that you can potentially reduce your risk of getting Alzheimer's disease.